What's up, guys? It's Alex here, and today we are talking about testosterone shots. They're a very big step in transition. If you didn't know that and you are new to the transition process, they're just generally called T-shots, just to make it simple. Now, what is testosterone? And you'll notice I'm looking at my laptop screen, and I hope that's okay with you guys. I don't know that much, so I had to do some research. Testosterone is a naturally occurring sex hormone that is produced in a man's testicles. Small amounts of testosterone are also produced in a woman's ovaries and adrenal system. So, it also continues to say, testosterone injection is used in men and boys to treat conditions caused by a lack of this hormone. So, this could also mean, on the site, we are classified as women until we fully transition, and I'm sorry if that causes any dysphoria, but for all intents and purposes, that's how the testosterone website that I'm looking at sees us. But you can also see as used in men and boys to treat conditions caused by a lack of this hormone, which we do. We lack it a lot, and it's what makes it so we can't produce facial hair. Alright. There are some safety dangers before you take it. If you're allergic to it or have male breast cancer, prostate cancer, a serious heart condition, those you can't take it. You have to be careful about how much you take of it. Sorry. And to know if it's safe, you have to tell your doctor if you have diabetes, an enlarged prostate, a history of heart diseases and that kind of stuff, high cholesterol, liver or kidney disease, if you're bedridden, or if you have a blood thinner. Okay, so now that we have all the safety stuff out of the way, a testosterone injection is given into a muscle about every 2 weeks, and the length of the treatment, for us, it would be until we get our top surgery and our bottom surgery. It won't enhance athletic performance and should not be used for it. And if you miss a dose, you should call your doctor. What happens if you overdose? If you're taking it safely, you won't overdose. So that's the key, just take it safely. Some testosterone side effects. The important thing that I really wanted to hit. Nausea or vomiting, changes in skin color, increased or ongoing erection of the penis. So basically, that wouldn't apply to us yet. But if we were cis men, that would be the case. Impotence, ejaculation problems, decreased amounts of semen, painful or difficult urination, shortness of breath, swelling in your ankles or feet, or rapid weight gain, signs in a blood clot of the lung. So that's definitely when you want to go to your doctor. Signs of a blood clot in your leg, high levels of calcium in the blood, basically causing stomach pain, constipation, increased thirst, joint pain, liver problems. Women receiving testosterone may develop male characteristics, and this is where I would say that they classify us as women because we are not transitioned yet. Acne, changes in menstrual periods, or if we take it long enough, our menstrual periods go away. Although, if you're on your period, know that you are one of the manliest of men. The manliest of men to be able to handle blood coming out of your body for about a week. Male pattern hair growth, such as on the chin or chest, so facial hair, all that. Hoarse or deepened voice, and large clitoris. Common testosterone side effects may include breast swelling, headache or anxiety, increased facial or body hair growth, male pattern baldness. So, something to think about. Although there's always wigs, guys. There's always wigs if you really want to go on testosterone. Increased or decreased interest in sex, Now, I will say this. Every time I've heard anything about testosterone, I've heard that it is an increased sex drive. From any trans guy who has transitioned, and I've heard, and they're telling their story, and they're describing what it does to them. That's what they say. Numbness or tingly feeling, or the pain or swelling where the medicine was injected. Now I will read directly from the site. This is not a complete list of side effects, and others may occur. Call your doctor for medical advice about side effects. You may report side effects to the FDA, Federal Drug Association, for those of you who don't know, or may not live in the U.S., at 1-800-FDA-1088, and it's free. So, other drugs, and as a last thing, other drugs may interact with testosterone, including prescription and over-the-counter medications, vitamins, and herbal products. Tell each of your healthcare providers about all medicines you use now and any medications you need to stop or start using. So that is it for this video, this infomercial for testosterone. It's very important that you do know what testosterone is, that you know what you're getting into when you start taking testosterone shots, or if you're just a friend of someone who is transitioning, who's a transgender guy transitioning. Let them know about this information. Share this video with them. It's very important that they know the safety concerns and side effects that will happen. I will leave a link to where I got this information from. If you can find a better site, I'm very sorry for using this site, but this seemed very accurate. It's drugs.com. But I hope that this was helpful for anybody transitioning, for anybody in need of information, for their friend or their family member. I will see you next week. Have a good day, guys.